My name is Allison Berg, and I'm a nurse on the orthopedic surgical unit and will be one of the nurses helping to take care of you after surgery. I will be addressing some of the questions that you might be afraid to ask or are not sure how to bring up.
What can you tell me about sex after spine surgery?
So sexual activity might be an awkward topic to bring up, but it might be something that you're thinking about in the back of your mind. So sexual activity after spine surgery is something that you should refrain from while your body is healing. However, later in life, having a rod in your back or a tether connected to your spine does not impact your sexual activity.
What about pregnancy after spine surgery?
So pregnancy and childbirth might be another topic that you're not sure how to ask about. So having a rod in your back or a tether connected to your spine does not impact your future pregnancy or childbirth. So you have the ability to get pregnant and carry a child to term and also have an epidural or deliver that child in any way you'd like.
I've heard that spine surgery can cause some people to have their period, even if they've just had one or never had one. Is this true?
So getting your period after surgery might be something that you're thinking about or concerned about, so not an uncommon question to have. The surgery itself is a big stressor on your body, so just like any other type of stress in life, it changes your hormones a little bit. So getting your period after surgery is actually common. Even if you just had your period, you may get it again. If you've never had your period, this may be the first time, so something good to know. But it's important to know that it's a normal response for your body and it's not harmful or dangerous in any way, just a surprise.
So, I've read a little bit about some people getting constipated after surgery. What can you tell me about that?
Constipation after surgery is something that you might not have thought about and weren't sure how to ask it. It is something that's common after surgery, and so being constipated or not being able to poop happens to almost everybody that has this type of surgery, and that's a lot to do with the medications they give you during the procedure itself, and also with the pain medications that you'll take after surgery and when you go home. So there's some things that you can do to help prevent that. First of all, it starts right after surgery. Day one, your nurses will give you some medication, some powder, a tablet or liquid that help with constipation. You'll go home with that medication too. So when you're taking your pain medication at home, also remember it's important to take your constipation medication. Another thing that's really helpful if you do get uncomfortable because of constipation is get up and move. So walk around, go for a walk. It really does help quite a bit, and that's something that you have control over and you can do. If those things aren't working out, there is a type of medication called a suppository, and that's a small capsule that does go in your rectum. Sounds embarrassing to think about, but it's very common after surgery. So it goes in your rectum and helps you have a bowel movement that way. If that doesn't work, then there is an enema, also kind of something that's embarrassing to talk about, but very common. That's a medication form of a liquid that goes into your rectum as well. Those two things just help if the other things aren't working. Again, it's very common. Almost everybody goes through a little bit of constipation after surgery.